My interest is in what happens after people get diagnosed with cardiovascular disease. They're at high risk. They're 4 to 5 times more likely to have another heart attack or another stroke within the following 5 years. But you can reduce that risk if you can get people to engage in secondary prevention. So that means taking just 4 medications: stopping smoking, doing more physical activity, eating a healthy diet, and managing stress. Together, these activities can reduce the risk of a further event by 80%. One of the newer areas in secondary prevention is managing depression. The association between depression and cardiovascular disease means that once people have had a heart attack or been diagnosed with heart disease, there's a much higher mortality rate if they're depressed. Depression also decreases motivation to engage in secondary prevention behaviours. Depression should be screened for and addressed. One of the most effective methods for secondary prevention is cardiac rehabilitation. We found we can help people with relatively simple strategies like group-based teaching and supervision of exercise. It's very effective. The problem is only 30% of people will go to cardiac rehabilitation for multiple reasons. Some people don't like going to groups. Some can't get to the hospitals where most programs are run. It doesn't appeal much to women. It's increasingly important that we address the gap in access to effective secondary prevention programs. So one of the things I've developed with a team of cardiologists, nurses and game developers is a heart game which runs on your mobile phone or tablet. Many secondary prevention programs and activities are very serious and not engaging, and we wanted to address that. The game is called My Heartmate, and the basis of it is caring for your heart. It's a bit like a kid's Tamagotchi, so you try to look after your heart and make it healthy and happy. And the activities you do to make that happen are the same as those that help your own heart. I believe we can engage people on a daily basis to get them thinking about what they can do and rewarding them. Then people will be much more engaged. Of course, it's still a prototype mobile application, but we think it's exciting and interesting. No one else has tried to develop a game for heart patients. We'll introduce the game to patients in hospital, and that way we'll be able to reach people that don't go to cardiac rehab. So we're bridging the gap. Other efforts to support recovery and secondary prevention include testing activity trackers for use in cardiac rehabilitation. There are many wearable devices being developed like fitness tracking devices. We found that, particularly during recovery from a heart attack or when patients have been admitted to hospital with other heart problems, they're very interested in how they can get back to being active and improve their health. They are motivated by having a device that tells them how much they've done over the day and that they can keep a regular check on, set goals and really improve their activity. We have found some wearable activity trackers to be relatively accurate, but a good pedometer is also useful. Of course, health technology is only useful if patients know how to use devices and are interested in learning or engaging in this use. Previously, many cardiac health professionals believed cardiac patients are too old to be engaged or interested, but our recent statewide work demonstrated that at least 80% of patients use mobile devices regularly, so it's important to reach people this way. However, comprehensive cardiac rehabilitation is the most well-established method to help people recovering from a heart event to decrease their risk and improve their quality of life, and we strongly encourage all health professionals to support patients to get to a program.